Hi, I'm pleased to introduce myself as Dr. Neelam Mohan, a Director, Pediatric Gastroenterology, Hepatology, and Liver Transplantation at Medanta, the Medicity, Gurugram. Today I'm here to talk on a very important topic: how to keep the liver of your child fit, and that's how your child is going to be healthy. Before I start with saying how do you want to keep your child's liver fit, isn't it important for me to tell you what are the functions of liver? It's really an incredible organ which is so vital that it performs so many functions that if I start rattling, it'll take me hours and hours. But to summarize, basically, it helps to digest your food. It releases bile, which is helpful for digestion, the fat that you eat. It helps to make, these foods which are digested, they get into the blood, they're stored, and it is stored in the liver like glycogen and is released when your body needs it. Your brain needs energy all the time, and it's the liver which stores and gives it. It helps to detoxify the medicines, the drugs, the alcohol, the steroids, the fatty acids that we have, ammonia and all, and that's how it's removed from the body into the environmental allergies, toxins, everything. The liver has to take the brunt besides the kidney, which can pee it off. So another thing it helps is to produce proteins in the body, which are very important, not only for clotting tendency to maintain and also for your immunity. The various reactions that are taking place in a body for our metabolism, those proteins are produced in the liver. It helps to store not only glucose in the form of glycogen, but so many nutrients like vitamin A, D, E, K, B12, zinc, iron, magnesium, all this are stored in the liver. And as I said, I can go on and on. So to summarize, liver helps to digest the food. It converts it into energy. It stores that energy in your liver. It releases it when your body needs it. It helps to filter the toxic substances that come in the body. It helps to produce the proteins which help in our immunity, in our clotting system, etc. What is so unique about this organ is that it looks like one. We have two eyes, two kidneys, but liver was one. Beware, God was kind. He gave you 50% as reserve in your liver. So that is the uniqueness about it, and the healthy cells can regenerate. Your brain cells can't regenerate, heart cannot regenerate, kidneys cannot regenerate, and pancreas, etc. But liver is one organ where the cells can regenerate. And that's how sometimes you wonder when your close kith and kin needs a liver transplant. You wonder how can you give a part of your liver off to somebody? The reason is the healthy liver regenerates. So the person who gives, they can regenerate back to the amount that is needed. It does not go on. And similarly, if the person who gets it, suppose it's a child, it will not regenerate at that time if it is enough for that child. And as the child grows and as the body needs it, the cells regenerate and get it as much as needed. That's so sweet and unique about this organ. So while liver is unique in this property of regenerating, mind you, it is the healthy cells that regenerate. The fatty cells do not work. And similarly, the part which gets fibrosed or scarred doesn't work. So we need to keep our liver fit and healthy. So the next question is, how do I know that what are the symptoms and signs of a liver disease? To start with, you may have a fatty liver or a liver disease and may not be symptomatic. There are instances where the patient or the person is asymptomatic and yet you have liver issues. But when there are overt symptoms and signs, we all know that it's a liver disease. Jaundice, dark urine, light color stools, which we call as clay stools, pain abdomen, vomitings. These are quite commonly that a child presents with, or with an abdominal distension, fullness of the abdomen. Besides that, the child may have easy bleeding tendencies, bruises over the body, or may develop fractures, etc. Itching and dry skin can also be a part of a liver disease, besides poor appetite, which we all understand can be definitely due to liver disease. But it's not always that a child has a pain abdomen or a vomiting or an appetite, liver disease. You need to consult an expert and rule out any problems related to the liver, besides other organs. Sometime when the liver disease is advanced, one might vomit out blood. That's an advanced condition. And similarly, in an advanced condition, you may end up with irritability, encephalopathy, drowsiness, abnormal sleep patterns. These are stages of advanced liver disease. What are the conditions that can affect a child's liver or an adult's liver? Number one cause is infection. Infections most often are viruses, which we call as the hepatitis A, B, C, E. D doesn't exist on its own. So these viruses have a different way of spreading. The hepatitis A and E spread through contaminated food and water. And hepatitis B and C spread just like HIV. That means through contaminated needles, pricks, etc., or from a mother to a baby. And in adults, of course, through unprotected sex, it can go through. So infections, viruses, besides this hepatitis viruses, that is A, B, C, E, the other viruses like COVID virus, dengue virus, the EBV, cytomegalovirus, herpes virus, CMV virus, there's so many other viruses which can affect your liver. In bacteria, the common ones like tuberculosis, typhoid, they can affect the liver. Leptospirosis can affect your liver. And malaria, which is a protozoite, and occasionally fungal infections can be threatening to the liver too. Mind you, any infection which is severe, which we call as sepsis, will affect the liver, because it's the liver which is metabolizing all, the drugs, toxins, etc. And so any severe infection can also affect the liver. So besides these infections, what are the other causes that can affect the liver? Is in a child, there could be structural deformities like biliary atresia, wherein the bile duct is not formed since birth, or colorectal cyst, where instead of a normal bile duct, the baby or the child is having a cyst instead of that, so it's not going to work. Metabolic or genetic diseases, because often people ask me, how can a child liver fail? Why do you need liver transplant for a child? So there are metabolic or genetic diseases where there is a defect in the enzymes. So that is why, like Wilson's disease, where there is a defect in copper metabolism, iron, hemochromatosis, conditions with that. There are conditions where you cannot digest the proteins that you eat, like in tyrosinemia, because it's the liver which helps in the digestion. Or where the liver is not able to store glycogen, so they are like those glycogen storage disorders, and bile acid synthetic defects and familial cholestatic disorders, etc. So these are all genetic or metabolic disorders which affect the child's liver. And besides that, there are conditions like autoimmune conditions. Your body doesn't recognize a part of your body as its own. So autoimmune, it starts fighting against that part of your body. And so there are some conditions which will affect the liver, and the body is fighting against this, where you need to suppress the immunity and prevent this fighting of the body against its own self. And besides that, less often we do see liver cancers, etc. But the $1,000,000 question, which I'm going to talk about now, which is preventable, is the fatty liver disease and the damage that you can do due to drugs and toxins. The other thing which I was talking about, metabolic, structural, etc., is not in our hands. But you would agree that fatty liver disease is preventable and effect due to drugs and toxins is preventable. Childhood obesity is really becoming a threatening situation. I think it's a global epidemic and India is not saved. So the childhood obesity is on an average going somewhere between 10 to 22%, depending on urban, rural areas, etc. And this is a matter of great concern because we used to be talking in India about malnutrition as undernutrition. And now India is seeing both the spectrum of malnutrition, which is the undernutrition, which we are trying to improve, and the next sword and the extreme arm is obesity, which is rather rising and becoming an epidemic. So earlier on, chubby babies were everybody's favorite. You would pull the cheek and say, wow, what a chubby baby. And I think in today's era, it's no to a chubby baby. It's no to overweight, it's no to obesity, because the ideal in an adolescent or an adult, what we talk about a BMI, the BMI normal would be 18.5 to just under 23, and overweight is 23 to just under 27, and obese is from 27 above. An extreme obesity, which we call as 35 and above. So in children, we have different norms. So parents must keep the graphs, which I'm going to show. These graphs is what a pediatrician would maintain with you. That is the weight and the height centile and the BMI chart in children, which are available in as the IAP standards. So these charts will tell you, is your child getting overweight or is your child getting obese? And in adults, we talk about the waist to hip circumference. That circumference, anything more than 8 in women and more than 9 in men, is a sign of obesity. And you would all agree with me that we Asians have a tendency to store our fat in our bellies. You may have normal arms and legs, but the whole fat comes in your abdomen. That is obesity because that fat gets deposited in the organs and can give rise to a fatty liver. How does one get obese? What is the pathogenesis of obesity? Because sometimes I'm asked this question that the other person eats 3 chapati and I eat 2 chapati. Why am I getting overweight or obese? Well, dear friends, there are a couple of things which come into play. It's what you eat. Like we're talking about the energy, the calories that is going into, and also your energy expenditure. So the balance between what you eat and the energy expenditure is there. And of course, sadly, there are some genes which we've identified, which tend to, which we call as the obesity genes, which tends to store more in what you take and then you keep it back. And at the same time, there is something like a basic metabolic rate. That means even if I sit and don't do anything, my body needs some amount of energy to drive the processes in the body. This metabolic rate may differ in different individuals, and that's how you can explain the energy intake, the expenditure, and your basic metabolic rate. Based on that, your obesity would occur. So what are the dietary changes we ended up with in children? Our serving sizes have become big. The variety of food has increased. We've started using energy-dense snacks. The frequency with which we've started eating outside food has increased. So all these changes has, in the diet that has led to this. along with it, I was talking about the expenditure, television viewing, sitting and being on the computer games, a sedentary lifestyle, going out little less, everywhere you have a car, etc. Cycling is so much less in our country. And sleep deprivation, kids and adolescents, you will be shocked when I see patients coming in my office. The child, even small children, they have a mobile and they're just sitting, opposite to me, sitting all the time and seeing the screen while the parents are talking. And, it's like when I ask them, what is the screen time? Don't ask about that. It's in hours, doctor. So this is absolutely wrong. The screen time of our kids has hugely increased, and that has given rise to increase in obesity in children and adolescents. So that balance between what you eat, what you spend, and your BMR all affects, and then it becomes a vicious cycle. The child gets overweight, and then the child actually feels shy to play or be with others. His habits doesn't change. He or she gets more increase in the weight, and then the child gets obese. Once the child gets obese, then the stamina gets less. The child doesn't want to play with the other children. There's a little shyness. And so the other kids don't want the child to be participating in the various games, and it gets further worse. And then once it gets further worse, he's get from mild obesity, he gets into moderate, severe obesity. And then what happens? Then you get problems like you might develop increased tendency for breathlessness, asthma, fatigability, pain. These symptoms start coming in, your liver gets affected, so your stamina gets affected. And so that's how the vicious cycle starts, and it gets worse and worse. The side effects of obesity are so numerous. Let's start with liver. First, the liver gets fatty, and then there is chance for gallstones. The blood pressure can get high. We all know hypertension is a side effect of obesity. There is dyslipidemia. The cholesterol and the lipid profile can change in the body. There are issues related with joints, fractures, slipped epiphysis. There are gut issues like constipation, IBS. There are issues related with your respiratory system, like I was talking about asthma, sleep apnea because of obesity, and of course, last and not the least, the behavioral and the psychological problems that one faces due to obesity. As your peers may not consider, may not want to jingle with you, be with you, etc. So there are a lot of other psychological problems, your self-esteem, your self-look, all this might disturb. And of course, we all know that diabetes is very often seen in obese people, and in girls, you might have the polycystic ovary disease. So dear friends, these are the side effects of obesity. Coming to the Indian scenario of obesity in children, it's really getting worse because we started something for, few years back, we were talking about 5-7%, and now in children it has gone up to 10 to 22%. And if I take obese children, then it is the fatty liver is to the incidence of more than 30%. The prevalence of diabetes is increasing in India, obesity is increasing in London. It's said that 1 in 3 individuals would end up with a fatty liver disease in them. So this metabolic X syndrome which we talk about, what is it? Basically, it's like a combination where there is obesity, there's hypertension, there is diabetes. This all is secondary to insulin resistant. lipids dysfunction, and the fatty liver. So this, we often club it and call it as the metabolic X syndrome. And one message I want to give to parents is, if you think your child is overweight or obese, look at the neck of the child and the knuckles. If you find some black lines, don't think that is something like a mud out there. We call it acanthosis nigrans. It's a condition which tells that this child who's overweight or obese with that dark lines, acanthosis nigrans, has a very high incidence of developing diabetes, fatty liver disease, dyslipidemia, and hypertension, etc. Fatty liver disease in children could be due to organic causes like metabolic storage disorders, glycogen storage disease, galactosemia, Niemann-Pick's, Wilson's disease, hepatitis C, etc. But there is a term we like to use where there is no other cause where we can say is the culprit for the fatty liver disease. That we label it as MAFLD or NAFLD. MA, metabolic associated fatty liver disease, which is due to obesity. And we used to also call this word as NAFLD, which is non-alcoholic fatty liver disease. You might wonder why we call it non-alcoholic, because alcohol was supposed to be the commonest cause for fatty liver disease in adults. And when this obesity gave rise to fatty liver disease, they called it as alcoholic and non-alcoholic. The same term in children, we went on to call it as non-alcoholic fatty liver disease or metabolic associated fatty liver disease. In obese children, globally, the incidence is to the tune of 35%. 1 in 3 obese children will have a fatty liver disease. And in my own institute at Medanta, we did a study which we presented it at an international level, where we looked at the obese children who had fatty liver disease and who ultimately and their liver enzymes, and our data was 30.8%. So 31% of obese children who came to us had abnormal liver enzymes and fatty liver disease that is due to that. So what happens? It starts, the normal liver, it starts storing fat, and then the liver cells they deposit fat and the fatty cells don't work. So it starts with 5%, 10%, 15, 20. So the fat in the liver goes on increasing. Then there is inflammation, sojish, that we use the word as NASH. And after the inflammation, there is scarring in the liver, which is fibrosis and cirrhosis. Cirrhosis is the end-stage liver disease, which is the scarred liver, which ends up producing a cancer, or you need a liver transplant to save that cirrhotic. You might wonder, why am I talking about cirrhosis in a child and a fatty liver disease? Dear friends, we now know that the seedlings are laid in childhood. It is the childhood who liver gets overweight and obese, and with this fatty liver, it would take 1.5 to 2 decades. So when they become adults, that is the time they end up with a cirrhotic liver or an end-stage liver disease or a liver cancer where they need a transplant. Did you know the commonest cause of liver transplant globally is non-alcoholic fatty liver disease? It has outbeaten even alcoholic fatty liver disease. And similarly, in India, we used to have hepatitis B and C as the commonest cause of liver transplant in adults. But now it is the fatty liver disease, the non-alcoholic fatty liver disease, besides the alcoholic, which are the commonest cause of liver transplantation. Remember, prevention is better than cure. Today, I'll give you some facts which would be eye-opening. Breastfed children are less likely to be overweight and obese at school entry. Breastfeeding for 6 months is associated with reduction in overweight and obesity by 30 to 40%. So, while in India we became more modern, more westernized, etc., the breastfeeding rates have dropped in our country. And I just wanted to give this facts and impress onto you the importance of breastfeeding in your life. Each mother should realize that if she wants a healthy child and healthy adult, it is the first 6 months of life that she needs to focus on breastfeeding in the child. Another fact, babies who are born small for gestational age or low birth weight, they have a higher chances of overweight and obesity in later life. That's called as the Barker's hypothesis, because they, we tend to overfeed them and try to, the body tries to save that energy to gain on the weight. And that actually ends up with higher tendency of being overweight and obese. 20-year follow-up of children who were overweight in preschool time, if they were overweight, in adulthood, they have 25% chances of being overweight. So, dear friends, it's no more a chubby baby. Even the preschool babies who were overweight, 20 years later when we looked at them, 25% of them continued to be overweight. And now let's look at fact at 6 years. If a child was overweight at 6 years of age, then 50% of them continue to be obese as adults. If a child was obese at 14 years of age and had one of the parent obese, then 80% the child would be obese as adults. How can we prevent fatty liver disease? It's through a good diet and a lifestyle which is increased physical activity and reduced sedentary behavior. Some guidelines which have been there even for children and adults is what you should at least take 5 servings of vegetables and fruits a day. Minimize anything which is sugary. Sugar sweetened beverages are a big no. In a child, we also say limit your screen time to less than 2 hours and get your physical activity at least 1 hour a day. So these are the common suggestions that we give to parents to prevent obesity. I like to use this picture, the food pyramid. The food pyramid is where I tell my parents that when you feed your child, the triangle food pyramid, what should be least and what should be most. So most at the bottom, your thing should be vegetables and fruits. When parents come to me, they say, he doesn't eat fruits, he doesn't eat vegetables. That is half the plate in the food plate that I'm suggesting you. So fruits and vegetable are half the plate that you need to eat, and the rest half is your whole grains and the proteins. A dairy should be a low-fat milk that one should take. Green, go for it. Any amount the child wants to take, vegetables, fruits, eggs, nuts, seeds, beans, lentils, dal, whole grain foods, cereals, breads, reduced fat dairy products like yogurt, curd or milk, lassi, and those who are non-vegetarian, the lead fish, chicken, etc., yes, you can go for it. Orange, go easy. What are these? The ones wherein you're ending up with full fat dairy milk or reduced fat, but yet some cakes, muffins, or biscuits which you think are there, and processed food wherein preservatives are being used, like jams and custards and cheese and fruit breads and pancakes and all. This, go easy, not too much of them. And a big red, which is a big no, is you could have guessed anything which is fried, anything which contains too much of, sugar. We now understand actually that between sugar and fat, we always thought that the culprit was fat, which gave rise to fatty liver disease. But what we now know, it's more than the fat, it's the sugar. It's the sugar which gave rise to fatty liver disease. So that is why now in children, even less than 2 years, we tell parents, do not give any type of sugar so that they don't develop that sweet tooth. You know that sweet is an addiction. So sweets are a big no. So any bakery products, I mean, like cakes, muffins, and biscuits, and these are a big no. Chips and those preservatives, juices which are Tetra Pak juices, and namkeens and samosas and kachoris and chocolates, and I think they're a big no. We need to use them very occasionally because we don't want us to get addicted towards these things. The family matters. Eat together. At least try to have 1 or 2 meals together. Limit outside meals as much as you can, because if young parents want to eat all the time outside, they take their child and then it gets a habit to get into it. Make the child learn to self-regulate the meal. Please don't overfeed a toddler and a young child, because it is these children who are at toddlers and as childhood who are forced to overfeeding. They learn that habit of overfeeding and they end up becoming overweight adults and obese adults. So that is a big no. And inculcate the habit of good sleep in your child. At least 1 hour of an outdoor activity, and please avoid your sedentary habits. To preferably, even if you're studying, etc., it should be less than 2 hours a day where you get addicted to your computers and laptops, etc., for adolescents. And for small children, I would like to say that the screen time is absolutely no for the younger toddlers. I see even toddlers with screen, it's a big no, because the cognition gets or the brain development gets hampered if you do. And for even older children, it should be very limited to just say hi, hello, and learning type of things. So physical activity, fitness, anything. It could be cycling, sports, dancing, aerobics, any amount of physical activity which the child likes should be encouraged for them. What should my target weight loss for my child be? Well, dear friends, for adults, we have some guidelines which say that at least 10% of the weight loss I need to get the inflammation out of the liver. And even as small as a 5% weight loss can help in reducing the fatty liver. So similarly, though we don't have the right targets, but we always say that try to come as close as possible to the ideal weight of that child. And till then, even a 5% weight loss would help in reducing the fat, and a 10% weight loss would help in reducing the inflammation and fibrosis. How can you prevent infections which can damage liver? So we know that hepatitis viruses like hepatitis A and E spread through contaminated food and water. So, good hygiene of food and water can help in preventing these diseases. There is a vaccine available for hepatitis A. What about B and C? B and C spread through contaminated needles, infected needles, and mother to child. So the precautions we can take is, one, there is a vaccine which is available for hepatitis B, and certain do's and don'ts. Please don't share toothbrushes, nail filers, razors with anyone. And if there is a child who's had a bleeding or a blood, just don't use your hand to control it. Try to keep a napkin or a handkerchief in between so that there is no direct touch with the blood of anyone. And tattooing, nose piercing, etc., these are not, they can be, they can end up with infections like hepatitis B and C. So these are certain suggestions that I would give to prevent the infections. And also those women who are pregnant, I would urge them to check on their hepatitis B and C, because there are medicines which they can take to prevent the transmission of infection to the babies or the newborns. One of the commonest cause for liver damage is drugs and toxins. Well, alcohol is a toxin. That's one of the commonest cause why the liver gets damaged. Besides that, several drugs, because it's the liver which metabolizes the drugs. So whenever we take medicines, please take it with the prescription of a doctor. A child is not a miniature adult. You need to know the right use of medicines. You'll be surprised. Medicine as simple as paracetamol, which we use for fever, if not used in the right dose and overdosage, can give rise to liver failure in a child. So consult a doctor and do not do over-the-counter drug purchase from any pharmacist. And where in India we have this OTC habit, taking medicines, they could be dangerous because they can damage your liver. Tuberculosis drugs, seizure drugs, anti-epileptic drugs, steroids, toxins, all these are drugs which you must consult a doctor before taking. And mind you, in houses, I would also like to warn parents, pesticides, use of pesticides and by farmers, etc., that can also be having a damaging effect on the liver. And similarly, indigenous drugs. We do not know so many drugs that are available. People talk like, I'm like whether Ayurvedic, herbal medications, etc. Those medicines where you do not know whether they have been tried, investigated, and looked for, they are a big risk in children and in adults too when we talk about the effect on the liver. So, how do we prevent a fatty liver disease? How do we maintain a healthy liver in a child? Parents, the way forward is a key message for you. Parenting style. Parenting is very important. You just don't, it's not inborn. There are 4 types of parenting. One is negligent, when you're not bothered what your child is doing. One is authoritative, which means you're like a dictator. When you're a dictator, then there is always rebel. The child and adolescent may rebel towards what you'd say no. And permissive, anything and everything allowed. Ji Hazur, that's wrong. So the right parenting is authoritarian parenting, where you need to talk out. You discuss with your child, why do this and why you don't do this? Why should you eat this and why you shouldn't eat this? Why should you not be leading a sedentary life? Why should you go out for play? So this is a very important method of parenting. Cooking habits for the parents is very important. It is it's the family who eats matters. It's like the habits of the whole family needs to be changed when there is an overweight or an obese child, because it's very often when we see overweight or an obese child, one of the parents is definitely overweight and obese. So the cooking habits, and parents, you're a role model. If you are eating unhealthy and you ask your child to eat healthy, is it possible? So be a good role model in your eating and drinking styles. Ensure that the child and you take adequate fluids, liquids, water, nimbu pani, nariyal pani, the soups, and fresh fruits rather than juices are better. And then no to sugary food, limited these sugary foods, fatty foods, fried foods, salty foods, preservatives, etc. Say no. Understand the importance of fiber. Understand it is so important for nutrients. To keep my liver healthy, to keep my body healthy, I need vitamins and minerals, and these vitamins and minerals are most in vegetables and fruits. You need whole grains as calories, but you need vegetables and fruits for vitamins and minerals. You need proteins for the child to grow, and proteins are there in beans, in lentils, and go for a toned milk, low fat milk if your child is not underweight in that case. And encourage them to play board games, encourage good habits like reading books, reduce their screen time because they're alone. The parents are watching television, the parents are addicted to mobiles and Instas and WhatsApps and Twitters and etc. And they have no time for the children. So, my dear parents, I think it is responsibility of us as parents to be the good role models, to give them time to talk about the healthy eating. And please avoid comparison, because that gives rise to stress in children. And stress in children has a negative impact on your body and sleep. And of course, when your liver and your unhealthy psychological reasons, you end up overeating. If you can talk to your schools, because schools should also try to play a part. The teachers are a very good role models, and they can be influencers in your child's life. You can talk to the teacher about the diet and the activity and the sports that need to take place in school. Together we need to work on children if you need healthy adults, because the seed is in the childhood. If you want healthy adults and no fatty liver in adults and no cirrhosis and etc. problems in adults, try to work with your children with the right eating habits and do's and don'ts for them, and the healthy lifestyle to ensure that they have a healthy liver and a healthy body. Thanks for watching this video. Hope today's talk on how to keep your child's liver fit and healthy was useful and you enjoyed it. Stay tuned for more such topics. And this is Dr. Neelam Mohan signing off.